let's talk about another top tier medication you're going to want to know for the NCLEX exam. So today we're going to be talking about an antipsychotic medication called Clozapine. Okay, this is considered an atypical antipsychotic medication that's used to treat schizophrenia. Now, this medication is typically only given when other treatment options have failed, right? When standardized treatment or more traditional treatment is no longer effective. What we need to know about this medication, it's a very high alert medication, meaning it comes with some potential side effects that we need to be aware of. So how does this medication work? It works by reducing or helping to reduce schizophrenic behavior and suicidal behavior. Okay, so precautions and side effects that we want to worry about right out of the gate is agranulocytosis. Okay, this is a potentially life-threatening blood disorder that is associated with dangerously low blood cell counts. Okay. And so we want to make sure that we are monitoring our white blood cells, right? We want to take lab of neutrophils and also do a complete blood count, okay? And an ANC in this case. Because here's the thing, this is a potentially life-threatening blood disorder, but if it's caught early and we implement early intervention, we can reverse this issue, okay? Other side effects we want to be watching for is fever and sore throat, okay? This may indicate that this patient has an infection due to neutropenia. So we want to make sure that we are notifying the HCP in that case. We also want to be watching for extrapyramidal symptoms and neuroleptic malignant syndrome. This is also something we want to be intervening very quickly for. And we also want to be mindful this medication can cause cardiac arrhythmias, hepatotoxicity, deep vein thrombosis, and pulmonary embolisms. Okay, so there's a lot happening here with this medication. Nursing interventions and nursing considerations that we want to be aware of. Obviously, we want to check our labs, right? We need to do a CBC. We're going to check our white blood cells and we're going to check our neutrophils. We're going to do this on a weekly basis, right? We need to do this throughout the duration of therapy. We're going to notify the HCP if the patient develops a fever or complains of having a sore throat. And we're also going to educate the patient and monitor for any signs and symptoms of not cardiac distress, right? So shortness of breath, angina, tachypnea, those types of things. We're also going to monitor for neuroleptic malignant syndrome, right? Fever, respiratory distress, any kind of diaphoresis, tachycardia. We just want to be monitoring for those things. And then we're going to also assess the respiratory status, right? And monitor for DVTs and PEs, right? Any kind of dyspnea and all of that. As always, if you found this helpful, make sure you're following this page, save this video for later, and take a future nurse.